Good afternoon, North Dakota. Thanks for tuning in. Again, appreciate your active participation in this process as someone who's interested in staying informed and helping North Dakota navigate its way through these unprecedented times. Today, we just got off the call with the Vice President and the White House Coronavirus Task Force. Usually this call is held on Monday. This week it was Tuesday and bumped right up against our press conference today. But in addition to Dr. Burke, Dr. Fauci, Dr. Hahn from the FDA, Dr. Redfield from the CDC, and Seema Verma from CMS, and Admirals Girar and Polochek, and Pete Gaynor from FEMA, so the entire senior leadership team that's helping coordinate this across the country was on the call. And again, from that, the learning and from other states highlighting and learning what some of the challenges that were on there, because we also had updates from Governors Bill Lee in Tennessee and Doug Ducey in Arizona, and others across the state, Mike DeWine from Ohio. Hearing about what other people are approaching, I think that brings us some context for the situation we find ourselves in today. We got a number of topics to cover today related to COVID, including an update from Commerce Commissioner Michelle Kommer. Thank you, Michelle, for being here to talk about the Economic Resiliency Grant Program, which we've launched. But I do want to start again with with some of the news in the announcements that related to what we're doing here today. We have active cases have been on the rise in North Dakota. We crossed the 1,000 active cases 3 days ago, and active cases is those that actively have the virus but have not yet recovered or passed away. And so when we crossed that, so it's the third day in a row we've been above that milestone of 1,000 active cases. And then 3.6% positive was the daily positive rate today, and that's the highest it's been since back in late May. With that higher increase in some other prior days since we were here last week at that 3% range, our 14-day rolling average positive rate has also increased to 2.77 statewide. It's still relatively low compared to many states, but it's going in the wrong direction. This is our 14-day rolling average positivity rate, and of course this takes the percent of positive tests we have out of all the tests we've taken in that day. The blue line on here is Cass County, the white line is the North Dakota average, and the Burleigh-Morton line combined, those two counties, is the gold line. And you can see what's happened here is that what's happened in Cass County, and of course the work of the Red River Valley Task Force has helped drive that number down. The goal of that task force when it was created was to get Cass County below the state average. That's been accomplished. But when the same time we've seen Burleigh-Morton, which for a long time back was way below the state average, got above it, then it tracked evenly with Cass County for a period of time in terms of positivity rate, and then now in the last few weeks has shot ahead. And so that's something we're going to talk about today. Today also from a milestone, so if one milestone is that we're over 1,000 cases, another one sadly is that we're reporting our state's 100th death today. This was an individual who passed with COVID-19, was a woman in her 20s from McKenzie County. That's our third death of a person we've reported with COVID-19 that's been reported without underlying health conditions, also the youngest deaths. And so our deepest condolences and prayers go out to this young woman's family. Losing a loved one's never easy, especially when you lose someone so young. And we know that these can have profound effects on families and friends and relatives, and they ripple through communities. So again, on behalf of the First Lady and Lieutenant Governor Brent Sanford, we extend our deepest sympathies. As the numbers are reporting today, we're particularly concerned about what we're seeing in Burleigh-Morton counties combined. Burleigh-Morton today had 62 of the new cases out of 157 positive cases. I know last week we talked about a day when we had 160 cases in one day, but as we reported that day, that the day before was 80, that day was 160. There was a lab issue with a machine that broke down that had to be overcome. So some of the tests that might have been reported last Monday got reported on Tuesday. So we're looking at those as 2 days of kind of 120 each. The point of all that is that while today isn't officially our highest day, in my mind, this is our highest single day total, because last week's was kind of a day and a third combined together. So again, from a total new cases going the wrong way, positive rolling average going up when we want it to go down. And Burleigh-Morton, the 14-day rolling average for Burleigh-Morton is, as you can see on the slide, is 4.12 compared to 2.77 statewide. And taking Burleigh-Morton together, it's our second largest metro area, and we want to make sure that we're keeping a handle on it. As I've said before, that if we saw the numbers rising here, we would form a task force. So today we're announcing the formation of the Burleigh-Morton COVID-19 task force. And similar to the Red River Valley COVID-19 task force, the Burleigh-Morton task force will strengthen what's already quite strong coordination between a number of players here, which include the Bismarck-Burleigh Public Health, Custer Health, which serves Morton County and additional counties to the west, our local hospitals, long-term care providers, city and county leaders, the state of North Dakota, and other stakeholders, including those from the universities here, which include University of Mary, the Bismarck State College, United Tribes Technical College, and also Bismarck K-12, because we're not that far away from entering back into school, and we want to make sure that both K-12 and higher education has a seat at the table. And then other big employers in this area, in places where we've got large congregate people in the Bismarck-Mandan area, includes the state of North Dakota, and so there will be some representatives from state of North Dakota, because this is obviously where the headquarters of the state government is, and then also the state penitentiary, where we've got a large population there, which at least to date we've done a great job of keeping COVID out of our corrections facilities, both in Bismarck and Mandan, but we want to make sure it stays that way. Like the Red River Valley Task Force, the goal is to work on preventing and mitigating the spread of COVID-19, and we'll think from the collaboration of that group, breaking down any silos that we might have across counties or cities or agencies or institutions. We'll be dedicating resources to assist in 3 areas. The first is prevention measures, including testing, getting everybody on the same page about a focused testing strategy. One, of course, diagnostic, which is when we're testing people who are sick, and then surveillance testing, which we've been doing a great job on, we'll continue to do relative to high-risk populations, because there also are a lot of long-term care facilities in these 2 counties, in Burleigh and Morton, and also a lot of long-term care workers. That testing strategy will be developed in conjunction with local public health, advising physicians and the North Dakota Department of Disease Control experts. And of course, we've got to make sure that we're also just not only testing, we've got to make sure that we're upping our game on contact tracing and isolation, so that when we do find positives here, that we can make sure that those people isolate as well as their contacts. Because one of the things that we know from our contact tracing, that if people who've been exposed don't isolate, it's one of the reasons why this disease keeps spreading. As a matter of fact, the only way this disease can keep spreading is human to human, and because it needs a host to be able to live in. Can't live without being inside a human. And so that's why, again, some of the basic principles that we talk about in terms of social distancing or isolation work well for slowing the spread. In addition, as we've done in Cass County, we put together programs that supported isolation, quarantine, increased accesses for wraparound services for non-hospitalized positive COVID-19 and their close contacts, and whether that's help on shopping or services or distributed housing for those that might, if we end up with cases that end up in shelter situations where we've got to make sure that we give people, get people out of a congregate setting and can shelter. So at least we've got a game plan that followed, one that worked in our collaboration between Cass and Clay County, and we'll have some people on this task force with experience from that one, and so that will help us get sort of a leg up as we get charging on this one. But this combination of testing strategies, we also need education around prevention, and we're aiming to drive Burleigh-Morton's positive rate down below the statewide rate, and we want to do that as quickly as possible. And we've started to reach out this afternoon to a number of leaders about this. There'll be an additional, I believe, press conference tomorrow with additional information about those that may be serving on this task force. One of the things that we do want to duplicate again is the success that we had in Cass County. The 14-day rolling positive average there, as I said, is down in Cass County down to 2.73, lower than the state average. We do know that there's a number of things that from contact tracing that, again, I want to share, and we'll cut through all the national news and the politics and just talk about the facts that we know. When we find out people were positive, and then they go, I don't know where I could have gotten that, and they say, well, where were you? Where were you? Were you in contact with someone else who was positive? Do you work in healthcare? If the answer is no, they don't work in healthcare, then it's, where might they have been getting this? And of course, we're seeing that the average age of the people that are contracting this, lots of folks that are getting COVID-19 are in what I might call more of the socializing years, the 20s and 30s. But this is happening whether it's at weddings or dances, proms, partying at sandbars, socializing around sporting events, all the increased transmissible moments. And just for a brief effect, I thought we'd send a photo that was sent from a sandbar on the Missouri River between Bismarck and Mandan over the 4th of July. That was several weeks ago, but we know that we know that you can be asymptomatic, you can transmit when you don't even know it, and then it goes from one goes to another, and then and we know there are cases where people might have been at a bar, but they also work in long-term care in a healthcare setting, and that introduces it into vulnerable populations. So we're back to the same things we've said about being North Dakota smart, which is, again, if you can keep 6 feet of distance away, that's great. If you can't, wear a mask, wash your hands, and practice good hygiene. And so again, same game plan we've always had, and these things under North Dakota Smart are the things that cost the least and have the least amount of intrusion. What we've seen, again, let's just take Arizona, Texas, and other states that I believe to be well led. I know their governors. These were states that were on a similar positive trajectory as North Dakota. We all began opening up at similar times, and then what's happened there to slow the spread, to turn the corner down in Arizona, they've had to, again, close bars. They've had to close gyms. They've had to, have put out mask mandates. They've done a number of things that we know in North Dakota we're trying to avoid here, but the way we avoid that is by, again, it's not, as I say, not what government says, but it's about what people do. And if people want bars and gyms to stay open, then be North Dakota smart. If you want to be able to, weddings and funerals and all those things, then we have to be North Dakota smart when we're having these. So again, not moving the goalposts. We're testing, and we've got some of the best testing going on in the country, but then we want to contact trace those individuals and isolate those people to slow the spread. In doing this, we want to preserve hospital capacity, which we've done, and that helps us build up gives us time to preserve PPE and testing capacity. All of this helps save lives and livelihoods, but we really, again, need all North Dakotans to do their part. And one of the things that the Burleigh-Morton Task Force will be undertaking is, again, how to think about communication to reach folks that we may not be reaching with this messaging today, to have everybody understand that if you want to, as the president says, be patriotic, wear a mask and practice these smart principles, but also, again, for the younger generation who do have less risk of serious illness, but they've got great ability to transmit. And that's, again, where as we've said, the unevenness of the risk of this disease, because it's deadly for those with vulnerable underlying conditions, and it's not for people that are younger and don't have underlying conditions. And so we need to make sure that we are helping, that there's an opportunity for contributing to the social betterment of all of us by understanding that the actions that each of us take can affect not just ourselves, but our families, our neighbors, our coworkers. And so again, Fargo, again, has been making great progress. Their city commission last night, had a directive that was stronger encouragement about face masks being worn when social distance is even possible. They've made it mandatory on public transportation. I think that was a smart idea because in New York City there was thousands of transit workers that became sick and many that died. I think hundreds that died that were transit workers. There were people that came down with COVID in New York City. So we know that public transportation was one place where this was spreading in metro areas. So anyway, we have 19 counties across the state that still have had less than 10 cases than this pandemic, and so since the pandemic began. So again, this is very uneven across North Dakota, but we know the people in those lower population, more rural counties with low cases, often they come to the Fargos and the Grand Forks, the Minotts, the Bismarcks, and others to shop. And so again, good idea that when they're here, that they're not bringing something home with them other than just the groceries or their supplies. And so again, if you're traveling to one of these metro areas, good time also to practice the North Dakota SMART principles. When we get into the actual numbers here, let me pull up the slide here, but on the past 7 days, our North Dakota Department of Health has confirmed 946 additional cases out of 3,852 tests that were conducted, and again, these are either are or near records. I mean, most in a 7-day period since we've been reporting in terms of new positives and most testing, and that is our rate for those is 3.1, and that the 30,825 includes those folks that had been tested before and those that were tested for the first time. This is the point prevalence rate that we talk about, which is because these tests are all valid, even if someone was tested a month or two earlier and they tested negative, if they're tested again now, this helps us understand the distribution of COVID. On the right-hand side, the cumulative, this is 6,141 positive cases, and this is divided by the number of unique individuals who've actually been tested in North Dakota. We've done almost twice that many tests, but those are the number of unique individuals, about 20% of the state, and it's 4.1% cumulative is where we're at. And again, we continue to do a great job of testing relative per capita relative to other states. Long-term care is also an area of concern. We had a great success story in long-term care because the blue here represents the active cases found among staff. The active residents, which is the more vulnerable population, is in gold on the bottom. And through the work of the vulnerable population protection plan, the VP3, we nearly arrested this and brought it down to a very low level. On the presidential, task force today, the COVID White House task force today, they talked about Seema Verma and Dr. Birx talked about, one of the indicators, which is does a long-term care facility have more than 3 positives at one location as an indicator? If you got up to 10, then that would really be the alarm bells going off. We're fortunate still that even as it's gone up, we now have 39 current positive residents spread across a number of facilities, 73 current positive staff. Staff isn't as much of an issue in the sense that staff can go home and be isolated, but the 39 current positive residents, those require care, they require isolation, they create risk for other residents. That's up 13 residents from prior week and 32 staff from a week ago. And so again, as we've worked hard to meet the strong demand for visitation at these facilities. Again, we urge families to be very careful when they're visiting. If you feel you've been exposed to COVID, or if you've been in close contact with a positive, or if you've got any symptoms, we encourage you not to visit long-term care facilities. And when you do visit, if you're healthy and you're going, make sure that you're wearing the appropriate PPE, as in masks, and when you're there, and maintaining the appropriate distance, because once it's introduced into a facility, we know that it can be deadly and difficult to eradicate. But again, we'll continue working with all of those teams, and again, want to thank all the long-term care workers and the long-term care facilities and their leadership for working so diligently on this great track record in North Dakota. On our serial testing strategy, again, this past week, we tested a total of 12,754 North Dakotans for the first time, and which is about 40%, and then 18,098 repeats or serial tests. And again, if you think about a lot of the newly tested ones may have been individuals that were symptomatic and or diagnostic tests, and on the repeat testing, a lot of that is surveillance testing, again across healthcare workers, across can be across corrections facilities, across long-term care residents, across healthcare workers, et cetera, and this gives us our best snapshot in time when we're taking a look at this point prevalence, what we're doing. The asymptomatic rate is estimated to be about 40% by CDC, so it's very important that when we're testing through the surveillance testing, identifying positive individuals early so we can be quick to investigate, do the contact tracing, and stop the spread. And again, as I said earlier, this is we hit a milestone. We crossed over 150,000 unique tests, so over 1 in 5, 20% of North Dakotans who've been tested. So again, as more and more North Dakotans are tested from the first time, this is going to increase the number of potential newly tested North Dakotans. So we have to include on our point prevalence people that have been tested before to help us understand the spread. In this past week alone of tests that came during this last week, we found 277 of those tests through the serial testing. And again, that's why we're listening to our epidemiologists and scientists like Kirby Kruger at the State Health Department, Dr. Josh Wynn at UND, or Dr. Paul Clausen at NDSU, who all agree that the best point in time measure of positivity rate is the point prevalence, or the rate where we take all positives in a day divided by all tests taken on that day. That's the number we're reporting for the daily. And as I described, we're only using individuals for the cumulative rates, so we have got both ways to approach it covered and transparently shared throughout this pandemic. On the net case breakdown, we did have the 946 new cases, as I described, and 638 newly recovered. We had 6 deaths reported over the past weeks. And again, our condolences go out to all of those families. But with more new cases than we had recovered cases, that's why our active cases continues to grow. The 1084 is a new high. Out of 6,141 positives, we've seen 4,957 individuals recover, and as I shared, we hit this sad milestone of 100 deaths. In addition to the young woman that I described earlier, there was a man in his 70s from Burleigh County, a woman in her 90s from Cass County, a man in his 70s from Burleigh, a man in his 80s from Williams, a man in his 50s from McIntosh, all with underlying health conditions, as was the woman in her 20s from McKenzie County. And again, I think when you read that list, one of the things you'll note is that Cass was only one of those. When we see case counts go up and we see hospitalizations go up, hospitalizations and death are usually a trailing indicator. So that's why we want to look at the point positive, the point prevalence rate, and the active cases. Those are more of our leading indicators, but they're not as leading as we'd like them to be, because if someone is reported in a test today as being positive, that test might have been taken 2 or 3 days ago, and so we're even our most current data on this is usually a bit of a trailing indicator. But hospitalizations can often happen a week to 2 weeks after initial infection, and so that's even more of a trailing indicator. On the hospitalization, we've got 35 hospitalized. Only a percentage of those are in ICU. These are spread across the state. We still have capacity capacity, but we did have a call this morning with over 55 participants talking to all of the healthcare leaders from around the state and that are operating our hospitals and clinics around the state. And there is a concern because as more healthcare workers if they become positive, they've had contact with other healthcare workers, those are all isolated. And so we've got a number of healthcare workers that might be on the sideline right now being isolated at home. And so there is a concern not about beds, not about equipment, not about PPE, not about ventilators. Those concerns that we had 3 months ago are gone, but we still have some concerns, and we'll be putting some attention to make sure that we've got appropriate workforce to make sure that we can staff at need be if we continue to see cases rise. When we take a look at the rise in testing and active cases, we've said all along that testing is critically important to our ability to respond and slow the spread. And as testing increases, you might expect if they track the same, if there was no more prevalence of the disease, if testing went up and cases went up, but at the same percentage, then you'd be like, hey, that's fine, we're just doing a better job at testing. But as you can see on the gold line here versus the white line, that daily tests are growing, but active cases are growing faster. That's a reflection of the math that shows that the positivity rate is going up. And if we take a look again at this chart we showed earlier on the Burleigh-Morton and Cass, this goes back to the very beginning of the pandemic where we had great trend lines where things were dropping, and then we've been slowly but steadily going in the wrong direction with the exception of a pretty steep uptick here in Burleigh-Morton. When we take a look at active cases, the other thing we've seen is I reported the other day that we had, reported, but noticed that I think on Friday or Saturday, we had 28 of 53 counties that reported at least one positive. Today, I believe it was 30 or more counties that reported one new positive test today, and now we have 46 out of our 53 counties have at least one active case of COVID-19. And of course, the population vary by quite a bit, but let me go back to that slide. You can see right there, I think on the size of the number of cases in Burleigh County, which has got less population than Cass, but almost double the number of cases. You throw in Morton County, it is double. We've got double the number of cases in a smaller metro area. So this is again why the task force is there. But when we do active case per 10,000 residents, you can see that, well, we've got few cases in some of our counties. The darker the color of the county, the higher the number of cases per 10,000 residents. That again want to help people understand that as we were seeing, you can get this case anywhere. It can happen in rural areas, not just in metro areas. We did have through contact tracing one of the things that came up where we had a small cluster in a rural area where 7 people were tested positive for COVID. The 7 were 7 out of 8 that had gathered together at a rural farmhouse. And so again, it only takes one person to help this, again, highly contagious disease move around. And again, so we need to have make sure that we're being smart across the whole state, not just in a few counties. 371 cases in Burleigh-Morton. We did see a drop in hospitalizations since we were here last week, and because last week we were up as high as 57, so happy to see that thing drop. When we were digging back through the information, doing this thing Friday was reconciling discharge dates that occurred from the previous 7 to 10 day period. So there was a bit of a data correction in that it had us catch up. So we're on top of that now and making sure that we're working closely with all of these hospitals going forward. All hospitalizations will be reconciled daily with the Health Information Network, in addition to ongoing case investigations, and we're in the process of hiring additional data quality staff who will be trained on these information resources. Our team is also researching whether we can automate admission and discharge notices through the Health Information Network, because again, there were some lags in reconciliation that caused that both increase and that drop. But again, with 37 today, we're still in good shape relative to hospitalizations. We've also been getting a lot of questions about whether or not we should be dialing up our risk level from low risk is green. If you remember, we've got a 5-color scale in North Dakota, blue being what was called the new normal or the better normal, and low risk was green, and this yellow color was or orange was was a higher level of risk. For now, when we pull up this chart, we're deciding to make a decision to remain in green. And there's a few considerations that have gone into that, but I would point out that we have moved the dial in the opposite direction. When we've showed this chart before, our dial was closer to blue. Now it's closer to moderate or yellow because, as I indicated, we're slowly but steadily we're going in the wrong directions. But why would we stay in the low risk? Part of the whole reason we started this process was to protect our hospitalization capacity, to be able to care for individuals at the highest level. In both the call that we had this morning and one that I had last week with some of our large providers, one thing we know for sure that can help drive the death rate down to this disease is actually better care. There is learning that's coming, both from Europe and from the New York metro area about the right appropriate protocols when someone is hospitalized to increase their survivor rate. And again, COVID patients now are only accounting for a small portion of the ICU beds and only in less than 1% of all occupied inpatient beds. And of course, we know that number of beds is not a fixed number because we've got surge capacity to go higher. The thing, as I said earlier, what we want to pay attention to is healthcare staff. And so again, our daily positivity rate, which today is 3.6, it's higher than it's been. And our 14 rolling rate is 277, as we talked about. But these relative to other states is still very low. And so again, we want to be cautious and we want to be smart here. We think that we can get the rate down in Burleigh-Morton through coordination and messaging and more prevention activity, and there's no reason at this point to make some change for the entire state. We want to be more targeted at working again at the local level. There are 11 gating factors that we look at from moving from one risk to another, and 41 of the 53 counties in our state meet the majority of the gating criteria, and so we'll continue to look closely at that. And again, but we've again decided the question has come up about, would you do this for certain counties? We've decided, again, not to take a piecemeal approach. We know there's a lot of mobility around our state in terms of people that commute into metro areas to work, to shop. And so at least for right now, we're keeping the entire state still on green, but green headed towards yellow as opposed to green headed towards blue. We've had a lot of questions from school officials about color-coded risk level and when it can move. And as we've explained before, there's not one single trigger. We have to look at the totality of the data, but to be clear, there's nothing, restricting a school district from more stringent protocols. I mean, if a school district said, hey, we're going to require students to wear masks, for example, that is all local control decisions that they can do. And as we, again, will continue to work through local public health and getting information out, we're still exploring whether or not we can release a number of actives by school district as opposed to by county. That might be helpful for school districts, but we're going to see if we can make that happen. Another thing I want to talk about going forward is what we'll call static testing, and static maybe is maybe a military term that's coming into play here, but we've had what we've sometimes called mobile testing, but this is when we've deployed large mass testing events. We've set out National Guard. We've done tens of thousands of tests by moving around the state with personnel, with capability, with setting up drive-thrus and doing all this. As we get more into the sprint that we were doing, you get caught up, and now we're moving more into with more of the marathon stage of how do we just continue to manage COVID. We want to move towards a couple of changes in our strategy. We want to make sure that we've got more testing labs across the state so we don't have as much dependence on just the state lab right now. It's an unusual condition. Most state labs might be doing 20% or less of the testing in a state. Ours has been doing 80% or more. That's a reflection of the fact that we, coming into this thing, we had no other commercial testing labs that were readily available in the state. state, but we want to bring the private sector on board. We want to bring the universities on board. We want to bring through point-of-care machines. The federal government is working to get point-of-care testing machines out to every skilled nursing facility in the country. There's a federal program that's starting to roll that out to 15,000 locations. And so, so we're going to, again, broaden our testing strategy and broaden the okay, all right, thank you. I know Mike washed his hands before he handed that to me. That was good. Okay, it's critical, of course, that people get tested. I mean, one of the things that did happen, I'm reading right here, is that we did have, even though we had these great numbers, over 30,000 tests, that was down about 15,000 from the last week. You get a lot of alerts, Mike. So it's critical that people get tested, and especially people who are sick, who have close contact, if you're working in healthcare. And so again, and individuals who are visiting long-term care. But we now have updated now, just in time, real-time information, we now have 19 testing sites established across North Dakota. These are 19 places that are physically set up. They're not mobile. They're there today. They're going to be there tomorrow. Our next phase is to expand sites to all 28 local public health districts and provide even easier access for citizens. And to meet this demand, we're planning on increasing testing capacity. The goal here over the next couple months is to head back into school, because we've had days over 5,000. Our goal is to be able to do over 8,000 tests a day to ensure and have the capacity to do that, to ensure individuals who need and want to be tested are able to do so. We'll continue to have testing events scheduled across the state this week and next. Scheduled times and dates will be available at the health.nd.gov test site. So we're going to continue to keep driving that forward. But again, when we have these physical locations where we can advertise, we'll get that out on the website. People will know where they can go, and we'll see more physical locations and less mobile sites, and that'll set us up for fall and winter. Thank you, Mike. Next up, we want to talk about our economic resiliency grants, or the ERG program. And as we fight to reduce the spread of COVID-19, we know that businesses are also fighting to restore consumer confidence in the marketplace, and improve safety measures have become increasingly important in that effort. And that's why we're grateful to have the support of the legislature, because these emergency resiliency programs, funding comes from the federal government, the coronavirus relief funds, which came to the state of North Dakota. It was approved unanimously by the Emergency Commission. The 6-person Emergency Commission went on to the legislative budget section, and they also approved this. And Michelle Kommer, who she and her team are working around the clock to support the economy in our state, she's joining us again today to tell us more about the ERG and how businesses can access it. Welcome, Michelle.
Thank you, and good afternoon, and I'm pleased to be here to provide an update on the Economic Resiliency Grant that was announced earlier this month and will be available to North Dakota businesses soon. Before we get into that, once again, I'd like to remind North Dakota businesses that if your business was financially affected by COVID-19 and you have not yet accessed the Paycheck Protection Program, there is still about a week to apply before that deadline on August 8th. The PPP is a loan that can be used for employee payroll and related expenses and certain operating costs. It's forgivable under certain circumstances. The recently enacted Paycheck Protection Program Flexibility Act relaxed the requirements for forgiveness, making it even more appealing. The PPP is available to North Dakota businesses through your local lender. You can learn more about the PPP at ndresponse.gov under COVID Resources, Business and Financial tab. Your business can also get assistance with the PPP loan and forgiveness application through your local Small Business Development Center, SBDC, which you can learn more about at ndsbdc.org. So on to the Economic Resiliency Grant, or the ERG. As was announced on July 8th, the ERG was designed by the Commerce Department in response to your business's needs to promote economic resiliency for our state. While the federal government has made billions of dollars available through the CARES Act to individuals, small businesses, healthcare systems, and other important sectors of our economy to mitigate the financial effect of the pandemic on our economy, the only certain long-term path towards economic recovery is customers' return to the marketplace. The ERG is one answer to the question being asked by North Dakota businesses: how do I get our customers back into the marketplace safely? The ERG is a grant available to private companies operating in North Dakota to receive funding for costs associated with improvements to their businesses for the purpose of reducing the spread of infection and instilling customer confidence in the marketplace. And the ERG will help with more than just getting customers back into the marketplace safely. The restoration of consumer demand also gets people back to work and reduces the burden on our unemployment insurance system and shows the rest of the nation that North Dakota is serious about being open for business safely. While the importance of the practices of social distancing, mask wearing where social distancing is not possible, and hand washing hygiene cannot be underestimated, this grant money will complement those practices by funding improvements to help control the spread of the virus, to inspire consumer confidence to return to the marketplace, again, safely. So how much money is available? There's $66.4 million available for grants to eligible businesses for up to $50,000 per grant, or $100,000 where there is more than one physical location, to make improvements in facilities, business systems, and equipment or supplies that reduce the spread of infection. Recognizing that companies have been proactive in making these investments, the grant may also be used for qualified expenses dating back to March 27th through the date of the grant closing. Which businesses are eligible? To be eligible, your business must be registered to do business in North Dakota with the North Dakota Secretary of State or a tribal licensing authority, or be a sole proprietor with at least one physical presence in North Dakota. Your business must have been viable prior to March 1st or is a new startup projected to be viable within 180 days and can demonstrate a negative financial impact caused by COVID-19. The applicant must demonstrate how the grant funds will directly decrease the spread of infection in the business place. And while eligibility is broad, certain entities are not eligible, like government entities, public schools, and most businesses without a direct customer interface. On to eligible expenses. The burden is on the applicant to prove that the investment is directly connected to investment control, as certified under criminal penalty. There are also resources available to assist businesses through the CDC or other industry associations. We've had many questions about back-ordered items. You may purchase an item that is back-ordered so long as it is paid for and installed, if applicable, within 45 days of the award. If an item may be purchased within 45 days but not installed within that time frame, those installation costs are not eligible. As mentioned, time is of the essence, both to control the spread of infection and due to the expiration date of CARES Act funding, which is on December 29th of this year. Categorically ineligible expenses include sales tax, refinancing of any debt, operating costs, payroll, investments not directly related to infection control, labor except to install infection control improvements. So when is the grant available? Since the grant was approved by the budget section of the North Dakota legislature the very end of June, the Commerce team, along with colleagues from procurement, information technology, and the Attorney General's office, have been working together to bring businesses a simple, compliant, and secure process for applying for this grant. Our original goal was the end of July, knowing that we are attempting to cut in half the development time of the process, but needing to balance quality and controls with speed for reasons that we've already already mentioned. We are in the final stages of designing the application and ensuring that we are staffed properly, and we will not go live until we've received verification that our processes are compliant, legal risks have been mitigated, and the process has been reviewed by our cyber team for your ease of use, safety, and security. So the application go-live date is not July 31st, but we will be announcing that date within a week. So what can businesses do right now? First of all, consult the FAQs that are available at ndresponse.gov for more information on eligibility, including company eligibility and expense eligibility. Prepare your ideas for use of the grant now. Register for a special business briefing this Thursday, July 30th at 11 a.m. At this session, you'll be provided with additional information to assist you in determining if your business is eligible, with more detail on the types of allowable expenses, timelines, and we will walk through the actual application step by step to provide you an overview of post-award obligations and to share additional resources with you. The session is free, as always, and open to everyone, but you must register in advance. We are once again partnering with GNDC to deliver this information, so you can register at ndchamber.com as a non-member. Also, you can ask questions ahead of time or at any time at businesshelp-covid19@nd.gov. Thank you for your time, and I'll be available afterwards for questions.
Thank you, Michelle, and thanks to your team for all the hard work they're doing to launch and execute and manage the fantastic ERG program. The next thing I want to talk about is the rent bridge reminder. And since we're talking economic relief, you know that right now the extra $600 weekly federal pandemic unemployment compensation benefit is ending. Again, that was on top, $600 on top of the $529 that North Dakota paid. This is the last week that North Dakotans will receive this, and it was the FPUC, the Federal Pandemic Unemployment Compensation. As you know, there's a negotiation going on in Washington, D.C. right now within the Senate about what level this might continue. It seems likely that there may be, they're highly likely that there will be some additional benefit, whether it'll be $600 or some number below that remains to be seen as part of those negotiations. But that short-term extra federal benefit helped individuals and families impacted by layoffs and economic downturn to pay their rent and other bills. With the extra payments ending, we want to remind North Dakotans that if you get into August and the federal government hasn't figured out what they're going to do with the extending the federal pandemic unemployment, and if you don't have an opportunity to go back to work at your employer, we do have, Team North Dakota has been working through multiple state agencies, Housing Finance Agency, Commerce, and Human Services to address housing and homeless needs during the pandemic. Emergency Rent Bridge, which offers short-term rent assistance for qualifying renters. That program, which we launched earlier this spring in the pandemic, is still available. And since it was launched, Emergency Rent Bridge has helped over 300 separate renters in 15 counties stay current on their rent, and it pays a portion of the participating household's rent. Payments are made directly to housing providers who must register with the program. And so then renters, again, can apply online, North Dakota Department of Human Services. So go there and look for the rent bridge, or you can go there, or again, I'm sure you can go to ndresponse.gov and there'll be a link there that'll take you to rent bridge. Departments also can assist renters who need help by submitting needed documents electronically. And again, housing providers can find information in the same place about how to register and validate rent amounts for participating renters. Same webpage under the northdakota.gov, nd.gov, DHS, info, COVID-19 rent bridge. The funding for the rent bridge comes from a number of federal funding resources provided in North Dakota. So again, that's part of the some of the federal funding that came in. And the reason why we're helping people stay in housing is because we know when people fall out of housing, this is a housing first strategy, keep people in housing. And because once they become homeless, we know that the demand for other services also goes up, food, nutrition, health care, mental health, and other services. And so this is a way to to actually save money relative to other services. And so again, we want to help people get through this time frame. Today, I signed a couple of executive orders. The first one, and I'd call these sort of red tape cutting executive orders, 2020-12-2. This extends eligibility for workers' comp benefits. We had done this earlier for include direct care providers employed by North Dakota providers, including the Life Skill Transition Center. It's anyone who contracts COVID-19. We did this earlier for people that worked in everything from funeral homes to hospital care settings, but we had admitted those that worked with vulnerable populations. So again, direct care providers provide care and support for health care, employment, and social services for individuals living with intellectual or development disabilities who made additional assistance. This executive order brings those workers, gives them the same opportunity for eligibility for workers' comp that other classes of workers working in risk environments did here. So this will ensure that critical direct care providers receive the support they need to keep serving North Dakotans, protecting their own and their clients' health. And then also today I signed Executive Order 2020-20.1, amending the order to include nursing home administrators in the suspension of in-person continuing education requirements for licensing renewal. We've done this again for other licensure areas because it's not practical or pragmatic, and certainly we don't want hospital administrators in large congregate classroom settings. And so the original executive order temporarily suspended in-person continuing educations for healthcare professionals, and this extends it and includes it for nursing home administrators. So both of these help reduce red tape and allow these people to focus on serving the individuals and the facilities that are in their charge. On the daily, not daily, but now as part of the press briefings, we've always had a behavioral health update. And today, behavioral health update is we're excited to share that the 4th annual Recovery Reinvented, which is an event dedicated to eliminating the shame and stigma of the disease of addiction and empowering communities to support recovery, will happen on October 28th, 2020, and it will be primarily an online interactive experience. This will be the first Recovery Reinvented experience delivered through a more accessible online platform to engage with participants amid the current COVID-19 pandemic. And as we've shared, the North Dakota Community Impact Foundation found that 68% of North Dakotans have experienced an increased mental health struggles during the pandemic, including anxiety and depression, and nearly 1 in 5 adults reported an increase in substance abuse since the pandemic began. So now more than ever, these conversations of hope for recovery is needed. This event, as always, is free and available to all. There's a number of corporate sponsors that have helped pay for this event over time. I want to give a special shout out to Hess Corporation, who's one of the lead sponsors, who even with the challenges in the energy industry remains one of the lead contributors to this event. So thank you for that. And we're going to give particular attention at this session to innovations that have occurred around virtual recovery support services, to telehealth, the intersection between mental health and addiction, and recovery-friendly workplaces. And to find more information, register for the event, share a personal story of your addiction or recovery amidst COVID-19, or nominate an individual or a group for one of a number of Recovery Reinvented awards at recoveryreinvented.com. And again, I also want to thank the great team, Jenny Olson, Joey Ness, and of course, first and foremost, the founder of Recovery Reinvented, the First Lady of North Dakota, Catherine Helgus Burgum, for her courageous work in this area. And of course, she will be one of the co-hosts at this event. And so again, I want to remind people that if you are struggling with substance abuse or mental health or addiction or any kind of crisis, there's free and confidential crisis counseling services that are currently available. Again, that's free, it's confidential, and visit projectrenew.nd.gov or call 701-223-1510. So again, thank you to that whole team, and thanks to Pam Sagnas and her team from the North Dakota Department of Human Services, the Behavioral Health Division, for the great work in providing these updates every day. They've been a fantastic partner and are a key part of Recovery Reinvented since the start. On the good news section, for today. We know we've talked about taking it outdoors and enjoying the great outdoors, enjoying the great state of North Dakota when maybe people are traveling less and enjoying outdoors more, something you can do with social distancing in North Dakota. And let's talk fishing. We've shared information before about how the Game and Fish in North Dakota were implementing safety precautions in order to continue the important work that they do in the spring, including fish spawning activities. Other states, we had a cabinet meeting, a virtual cabinet meeting last week, and Terry Steinwan, our terrific director of Game and Fish, has been in that position a long time. And before that, before he was director, was head of the fisheries division. Had a remarkable thing. I think when Terry started his career, there was maybe 100+ lakes, and now hundreds more that are offer great fishing in North Dakota. Other states around the nation, when the pandemic, they completely shut down their Game and Fish spring activities, but not in North Dakota. They figured out a way to do it safely. And team members collected, get this, 10.4 million northern pike eggs, 70.3 million walleye eggs, and trapped close to 200,000 yellow perch, and relocated these to lakes that needed additional stocking. Since that time, team members have stocked North Dakota's waters with an incredible amount of fish. 75,000 catchable, meaning right now, trout have been delivered into 55 waters, and that came from the Garrison Dam National Fish Hatchery. And again, that's the word national there. We're the only state where there's a collaborative effort between the national fish hatcheries and the state ones. We did have some out-of-state travel. We obtained 1,550 large cutthroat trout from Wyoming, and those went into 8 waters in North Dakota. 1,300 catchable channel catfish into 9 community fishing ponds. About 1,000 catchable northern pike trapped from areas with abundant pike populations into 4 community fisheries. 16,000 adult bluegills into 19 waters, again trapped from waters with overabundant bluegills, and 425,000 Chinook salmon smolts went into Lake Sakakawea. Now, I know that many of you thought that the press conference about COVID was filled with numbers, but who knew that Game and Fish could even have more numbers than the whole COVID pandemic. Game and Fish members also stocked a record 180 lakes. That's only a portion, less than half of the lakes in North Dakota. 12 million walleye fingerlings, more than 30 more waters stocked this spring than the previous record of 150. In addition to restocking lakes and supporting outdoor recreation, Game and Fish members still continue to educate North Dakotans about our great outdoors. Typically in the spring, school trips, visit a fish hatchery. I'm sure it's if you were ever part of a school trip to visit a fish hatchery, I'm sure you remember it. It was a fantastic thing to do, but often that was restricted only to students that maybe lived within a short driving distance of our fish hatcheries. This year, the Game and Fish members produced a video for schools across the state to use in distance education. We want to thank them for doing that. Students at schools now are able to learn about fish spawning, and we'll make sure that we get that link up because you're not going to want to miss that video. Fun for adults to watch as well. Game and Fish has been hard at work during this pandemic, ensuring our natural resources and our wildlife are cared for, educating North Dakota's managing populations, addressing invasive species, and providing access. We encourage all North Dakotans, take it outside, enjoy the hard work of Game and Fish that North Dakota has to offer. I would also say that they've had a part of this great season. We are up 30,000 fishing licenses over the year prior. Thank you for those that have bought a fishing license. If you haven't already, there's still time, and there's still a lot of great fishing left in North Dakota. In closing, with a gratitude quote as always, before we move to Q&A. Again, thanks for those that have listened in today. But well-known Coretta Scott King, she's the wife of Martin Luther King Jr. She was an author, a civil rights activist in her own right, said, "The greatness of a community is most accurately measured by the compassionate actions of its members, a heart of grace, and a soul generated by love." And I think when we think about slowing the spread of this pandemic, compassionate actions of members of the community is key to that. And that compassionate action means that you practice the kinds of North Dakota SMART activities that will help slow the spread of this deadly deadly virus. So with that, thank you all for being compassionate. Thanks for having a heart of grace. Thanks for having your actions be generated and driven by love of your neighbors and of your family. We know that North Dakotans have always risen to do it. They're doing it again, so thank you. We'll be back here next Tuesday at 3:30. Until then, stay healthy and stay connected with each other, and we stand for questions. Okay, I'm going to go to Lane, and then we'll go to the left side of the room. And I'm going to start in the back. We'll go Jacob and work our way up.
The state differentiates deaths due to COVID and deaths with COVID. Do we know if the woman in her 20s that passed, which one she falls under?
The report that we've received says with COVID. Jacob?
Governor, last time you wanted to boost testing capacity up to 6,000, you said you would rely on public-private partnerships to get there. To get to 8,000, what kind of investments are we going to need?
Well, I think the key thing we think about our testing strategy is the difference between diagnostic and surveillance. Diagnostic, of course, would be someone who's symptomatic. They present, they're with their healthcare provider. They're like, hey, I need a test. I don't feel well. When we get into the surveillance testing of larger populations, this includes, all of those university students coming back. And so one of the key partners that we expect to be part of this when we grow this capacity is with our universities, and we're working closely with Dr. Nguyen from UND, who's doing 3 roles right now. He's VP of Health Sciences at UND and the Dean of the Med School, but he's also the head chairman of the NDS US, the University System Restart, and he's also chairing our health strategy work. But as part of his work on the university restart, plus the connection with the university, working on how do we take the university labs that are available. This came up on the call today with the task force, and including key members of the task force that are working on testing strategy, because we know that when you get back to having university students all over the nation heading back into school, there's going to be a big demand surge for additional testing. And so the concept of doing pooling testing, where you might do 4 tests in one or 5 tests in one across a population, and then do those at university labs. There's a CLIA certification, which is a certified lab certification that is required for diagnostic tests. The government has waived that for surveillance testing. So again, if we were doing surveillance testing across these university labs, they still would be these PCR tests that we're doing now, with the nasal or oral swabs, so similar tests to what we're doing right now. But if someone came back as positive, then that person would be retested again, collect a new sample and be tested at a CLIA lab. But this again is a way for us to take some of the pressure off of our healthcare labs where they're trying to do diagnostic work versus where we're trying to do the surveillance. But as I said here today, again, 277, I think, of our positives this week came from surveillance testing. So it's an important work. And when we got students coming back and returning here from out of state, that's going to be a key part of it.
Do a quick follow-up, Governor. Last week you said that we had been stressing our testing systems thus far. If there were university labs available, why weren't we reaching out to them to start with?
We have been in conversations with them, and some of this was the additional flexibility that's coming from the federal in terms of the waiver on the CLIA, because some of the labs they might have been able to use for research work, but were not available for diagnostic testing. But we're in a better position. And again, I want to thank Dr. Josh Nguyen for his leadership. And when I say universities, the labs that we're talking about are likely exist within our research universities more likely. But we do have the vet lab at NDSU, which I want to thank to them, because we did move things where we were doing some testing like rabies testing and other testing here at the state lab. That got moved to the vet lab that created a capacity. So they've been partners, but we're going to expand that even more. Jeremy, and then Dave.
I think you mentioned that there will be some state resources available for the Burleigh-Morton task force. I'm just wondering what kind of resources those might be, if you could detail that a little bit.
Well, it's similar to what we did for the Red River Valley task force, which is, if we came in Fargo and did some of the mass testing events that we're doing. I mean, those were largely driven by the North Dakota National Guard and state resources. So I'd say, personnel, testing equipment, testing at the state lab. So some of that is already existing, but we'll try to identify where the gaps are and see if we need to bring some of the federal resources we have to bear here where we've got the most number of active cases. Dave?
This is for Michelle.
Oh, fantastic. Thank you, Dave, saving me again. Welcome back, Michelle Kommer.
I wanted to follow up about how specific do the applications have to be if businesses are asking for money? How specific are the plans have to be? Do they have to detail what they're going to do actually, or how detailed are you going to get?
Very specific, Dave. So the proposal will be evaluated, in fact, on the specificity of the proposal and the direct link and tie that's made to the investment's ability to control infection. Where there's ambiguity, we'll be working with the Department of Health to make sure that that investment does have a direct nexus to the ability to control the spread of infection.
You follow up in terms of making sure that they do what they said they're going to do?
So I think we talked a little bit about this on July 8th. We are going to have a fairly robust process on the back end. Again, it's important that we disperse the money quickly and that the investments are made quickly. There was some conversation originally about whether or not we would reimburse, but because of the deadline for the CARES Act money and because of the need to make these investments as soon as possible to control the spread of infection as soon as possible and to bring customers back to the marketplace safely, we did determine to go ahead and fund those investments up front, which is why the follow-up process is going to be robust. On Thursday, we'll be talking to businesses about their obligations post-award, and they are significant. They're going to have to agree to provide us with documentation that very specifically outlines how the investment that was made ties to the proposal. There will be follow-up, and we'll go over that more specifically on Thursday. Thank you.
Michelle, if I could add to that, because I know there's been some brainstorming, Dave, when we say control infection, that's the overall category, but there are so many ways to reduce spread. I mean, touchless payment systems, touchless faucets, outdoor dining is one of my favorites. I mean, I know that this has been talked, but it's going to be eligible if a restaurant says, hey, I need to add a pickup window that I didn't have. If I need to add outdoor dining and seating, I need to buy heat lamps to sit outdoors. I mean, so this is not all Clorox wipes. I mean, this is a chance to reframe your business model in a way where you could accommodate more people safely and therefore spread the infection. I mean, kind of using as a restaurant example, but it would apply to any business where you protect your employees, protect your customers, rebuild confidence, and I'd say use your imagination. But and I think the other piece which is going to happen on the back end is there are going to be random audits as part of the commitment on the back end. But I fully support the decision was made to get the money out quickly, very specific grants, get money out quickly, and then do audits on the back end. And I know that's something that the legislature has also encouraged us to do, and we fully support it from the governor's office. So we're in complete sync with the legislature on that. Okay, I'm going to go online and then to Tom and then to Jeremy.
To go back to the question about resources for the task force, Blake Nicholson with the Bismarck Tribune, what state resources, particularly money, will be dedicated to the task force, and where will that money come from?
The question for Blake, similar to the one I've already answered here, but we'll have to do an assessment first, get the task force formed, understand where the gaps are, and then again, we have already, through the coronavirus relief funds, dedicated money towards public health, and some of those expenditures have not. We've still got some capacity in that bucket, if you will, of coronavirus relief funds towards public health, and so that's likely where they would come from, because this would be public health related. We also have put dollars into the universities and higher education, and given that those institutions are here, and then some of it is things that we've already done. We've already used state dollars here in taking care of, again, large employers in Bismarck include state government and the correction system here. And so again, there's already been a lot of dollars that have been invested in this community, but we'll continue to look where the gaps are and use the federal coronavirus relief funds to help us bridge that and see what the need is. But in the end, questions are always about funding and, you know, millions here and millions there. I mean, pretty clear how you want to slow this thing down, and that's social distance, wear a mask, personal hygiene, and that's virtually free. I mean, that's like free compared to all these, what the hundreds of millions and billions that were either lost in income or spent in the southern states right now with these recent outbreaks. That dwarfs what could have been done by personal responsibility. And so again, when we say we're all in it together, if you want to have lower taxes, if you want to help get the economy going back on track, then do your part to help slow the spread, because that's what's going to really improve consumer confidence and help us protect lives and livelihoods. Okay, Tom?
So about schools opening, Williams County is considering right now when to open their schools. They have a meeting on August 3rd to recommend when to open schools. Dr. Fauci said over the weekend in a broadcast interview that there's much we don't know about how COVID-19 affects children. And he said that the one study that he's waiting for won't be available until November or December. Are we jumping the gun by opening up schools too early? And would it help? And the second part of the question would be, what would it take for you to decide to move from green to yellow?
Let me take the first part about, are we moving too quickly on the schools? Yeah, I agree. There's a lot we don't know about COVID-19 because we got a short history, less than a year globally, of trying to understand this rapidly moving infection. But Dr. Fauci was on the call earlier today on the video conference that I was on, sitting between Dr. Redfield from the CDC and Dr. Birx, and I think that whole task force is in agreement that this is not. I think Dr. Redfield said, this is not, opening schools is not about getting the economy going in. Opening schools is about public health, because if you have schools closed, there's a lot of things that are lost for children, not just on the educational front. I mean, nationally, 7.1 million kids in our nation get their mental health services through public schools. Millions and tens of millions of students get their nutrition through public schools. And here in North Dakota, there's so much going on in addition to the learning through the school system. And so we know that when we might be protecting kids from the possible spread of infection, we're also putting them at risk for all kinds of other things. And so it is the right decision. And Dr. Redfield and the CDC strongly supporting that. Now, do the local school districts have a lot of considerations about when and how they open? Absolutely, to make sure they do it in the safest possible way and in the context of how much COVID is in their area right now. But I think it's time for us to move forward and figure out how to do it. And as we talked about, every district in the state is going to have two things on file. They're going to have a health and safety plan that has to be approved by their school board, and they're going to have a distance learning plan approved by their school board on file with the state before they get their funding to go into this fall. And if breakout occurs, then they'll have to decide, do they close a classroom, do they close a school, or do they close a district, and then switch, when they say, meaning buildings, not stop teaching, but when they decide when would we switch, when would that district or that class switch back to distance learning. And so that's that. And on the yellow, the yellow versus green versus blue, covered that at the beginning. I feel like we're trending the wrong way, but we're still in green, and we'd like to reverse it, particularly here in Burleigh-Morton. Get that going the other way, and get the dial moving towards a better normal versus the low risk area we're in right now. Jeremy?
My question is also sort of about the risk level. I'm just wondering, I mean, for people who are looking at it, what are the specific thresholds for moving up or down? Because otherwise it sort of seems kind of arbitrary.
I wouldn't say it's arbitrary, but I think it's impossible to it's impossible to put all the variables even into the 11 criteria that we've got listed. So I would, people look at the 11 criteria, but if you said, if you said 3 months ago, hey, we're going to do it based on positivity rate, let's say if it, gets above, 5% or above a certain growth rate, and then it's, then we're switching to a different color level, and then we switch to a different color level, then that puts a bunch of economic restrictions, government mandates, or guidelines on certain businesses. So, we can have a positivity rate go up, but if it's people that are in their 20s and 30s and not in their 70s and 80s, and our hospital capacity stays the same, then that would maybe be the wrong criteria to try to restrict that. Because again, we're trying to balance, we're trying to do two things, trying to save lives and livelihoods. And so we're looking at a combination of all these and doing that in context. And like all decision making, it's complex, it's dynamic, and I think that when you come up with too strict of a set of sort of auto criteria, then you end up with things like a Washington D.C. travel ban on North Dakota travelers. I mean, it's like you end up with things like that because that was triggered by some number that may not make any sense. I mean, again, it's a math thing. I mean, you could have a state that's showing a decline that's got a higher % positive than our North Dakota, or 14-day rate of 2.7, that's allowed to travel to DC, and they've got a higher prevalence and more active cases. We've got lower active cases and lower percentage, but because we went from 2 to 2.7, then we're a growth state, and that might have triggered somebody else's thing. They're entitled to do that, but I'm just saying that's why I like to include a human factor around judgment making on these complex decisions. I'm going to go online, and then Lane, and then back to Jacob.
Jean Schemp with Hometown Radio Group in Minot. We're receiving many reports of North Dakotans having to wait 5 to 7 days or longer to get their test results, and some have never received their results, and calls to the health department hotline haven't helped. Are you aware of this problem, and is there a way to improve reporting time as cases continue to increase?
So, Jean, they would love to get the specifics, and maybe we can contact Jean offline, because if she's got specific data, we want to track all these down. Fast reporting is critical to this, and we've talked about making sure that we have turnaround times by lab, and make sure that those are publicized so that people would know. And as far as people never hearing or calling the hotline and not getting help, that's, again, I want to drill down into all those, because that's not, if that's happening, not acceptable, and we got to make sure that we fix that problem. Okay, I said Lane and then Jacob. Okay.
Governor, some of us in the office earlier were looking at some of the graphs on the DOH website, and one of them, the trending curve, seems like the ratios are off a bit because the active cases seem pretty flat because the total cases is skyrocketed. Is there any reason why both of those are featured on that same graph?
I don't know if there's a reason but if there's a sort of a graphical distortion because of the size of the x-axes on there, we'll take a look at those and take a note. Maybe we should split those into two graphs, because they wouldn't necessarily have to be shown on the same graph, and maybe that would make the slope of the lines more clear, because we want to make sure that our graphical representations represent our concerns, which is we got a low but rising number of active cases. Jacob?
Going off of Jeremy's question, I know how much you like it when we compare your decision making to the decision making of other governors, but when we have these 11 criteria in place and the human factor, we're seeing surrounding states making or re-implementing economic restrictions. You don't want to make a quick decision to re-implement economic restrictions, but at the same time, having all these criteria in place, doesn't it hinder you from possibly making a decision in a time where we're seeing record high numbers in active cases and positivity rates?
No, I don't think it hinders at all. I mean, because we're seeing record high cases, driven by what's going on in Burleigh-Morton. We're seeing, significant great drops in Cass County, which was an area of great concern. So I think we know how to get it done. And so I think we want to, go down a proven path that we have, which is if we, put all of our resources together, we collaborate, we work together, people respect and understand and communicate how the virus spreads, then we can quickly slow the spread of this thing. And, and again, I know I put the slide up, again, as an example, but it is when you have transmissible moments, that's where this thing goes. So, going to a bar, transmissible moments, crowded bar at 1 o'clock. I mean, I saw some videos of, some bars at 1 a.m. this last Saturday night that got sent around on Snapchat. There was not social distancing going on. There was not, nobody was wearing masks. I mean, that's a place where this could happen. Sandbars, wedding dances, funerals, could happen in church. I mean, and it can happen any place where you've got large crowds and no social distancing and no masks. And so when people are in those situations, they got to recognize that their own individual responsibility and the collective responsibility. And it's not like we'd say to someone, hey, you have to social distance for the rest of your life. I mean, people in Burleigh-Morton could say, let's be really strict about it, social distancing for the next 2 weeks. You'd see a change in the numbers right here. I mean, that would be one thing that you could do. If everybody social distance, if you can't social distance, everybody wore a mask in Burleigh-Morton, we'd see a change in the numbers. Arizona has seen a dramatic drop, from doing it. And there's studies that are out now that show that if you close bars, close gyms, and put in a mandated mask order, you get about the same drop as a shelter-in-place order. That's good news because, there was a whole, hue and cry this spring, against all the governors that didn't have shelter-in-place, stay-at-home orders. North Dakota was one of the few states that didn't, and we managed our way through that. Now there'll be pressure and examples, but again, we want to be data-driven about it. And I think, again, the appeal here is I still believe strongly it's not what government says, it's what people do. And so we're asking people, just as the people in Cass County did when things were high, you saw a lot more masks if you were in a grocery store in Fargo than you were, in the western part of the state a month ago. And now, the numbers are changing. And so hopefully we'll see more masks and more community thoughtful behavior here that would help slow the spread here, and then we can do it without having to have the government intervention. But none of those things are hindering me, and if the thing starts to climb, you've seen through this whole thing, I got no problem making hard decisions and making them quickly if we need to. I'm going to go Dave and then Tom.
Congress is fighting right now, or arguing or negotiating, whatever you want to call it, over a new relief package. Is there anything specifically that you'd like to see out of what they come up with?
Well, I think that one of the things that I know is being debated is dollars for testing, and I think that it's very important that we continue to fund a testing effort in this country, particularly when we've got all the school kids and the universities coming back in. I think that's key to that, and part of that is not just giving dollars to states. We've got to continue to support the investment side. I want to call it they've called it before the Manhattan Project, but we're spending trillions on relief, and if we had more robust R&D around vaccines. Now we've got great progress. There was a second vaccine that got to the clinical trials, phase 3 clinical trials last night. I mean, this is all happening in record time. And from the call today, where Dr. Hahn, who leads the FDA, I mean, he was assuring that everybody that they're not reducing any of their rigorous standards. It's just that American industry is moving at record paces, and this is why I think in the long run, I've said earlier this week, I think that people would like to think that the U.S. is the one that's struggling to manage all this thing. I mean, that's kind of a narrative. But the reality is that the innovation that's going to come on the innovation side, where it's innovation in public health, innovation on testing, innovation on new forms of testing, innovation on how to redevelop business plans, innovation around vaccines, the innovation path has always been America's strong suit, and we're going to see that. We're going to see enormous innovation that comes from this thing. And so I'm hoping that there'll be funding, not just for doing more stuff the way we've been doing it. I'm hoping that there'll be some funding that supports the rapid evolution of innovation to help us be able to be better prepared next time around on this. So again, supporting public health and supporting supporting testing would be a couple things. I'm on the record saying that I think the $600 needs to come down, if not go away, because we do know, talking to people in industry, where they can't get people to come back to work in North Dakota because you can, make more. I think, again, unemployment was meant to replace the income a person had, not give them a raise. And I don't think there's a commitment around that. I mean, I think in the nation, people were worried about, we're going to have a recession. Personal income went up in our country this spring. I mean, there was that much stimulus dollars that actually went up. That's why, talk to anybody that sells boats or RVs. I mean, hotel business is down, recreational equipment going through the roof. So we're stimulating the economy, but we want to make sure that we know that the real engine is not printing money. The real engine is people back at work doing, productive work. And so we want to make sure that we're balancing that right. But I'm sure it'll land at a spot that it needs to get a bill out. I think the thing that needs to happen is there needs to be a stimulus bill that comes out before recess. I mean, the thing that would be most disappointing if nothing came out. Well, something will be better than nothing. Tom, and then online, then Jeremy.
You've answered this before, but things have changed a little bit in relation to the reporting of out-of-state residents who test positive on the western side of the state. We get a lot of chatter in the Western media about that. People are concerned that they don't know the real numbers. You're a data guy. Can you give us some kind of data that would help us understand how many people in the western counties are testing positive and are not reported locally but are reported in another state?
Well, I asked this form of this question over the last couple days because I know we've been trying to update our policies and procedures. When we started 3 months ago, if someone listed out of state as their primary home or where their insurance was being paid, they were listed as an OOJ or an out of jurisdiction on our chart. Now through the contact tracing, and you'll see that in the little red print on the 11 a.m. that goes out every day, you'll see in there there's some adjustments of 1 or 2 every day. If our contact tracers find someone who had listed an out-of-state address but is their primary living location currently is here, or they're spending more than half their time here, then we include them in the local numbers. So I think the numbers now are more reflective of that, and we're doing the same thing with college students. So if we have a college student, that says that say they're from Minnesota or South Dakota, but they're living in Fargo, we're trying to make sure those are reflected as people that are living here. And while we could be missing some, we're on the right track towards increased accuracy. But when we've got COVID in 46 of our counties, I'd say that whether it's plus or minus a few cases, it doesn't change behavior. People have to pretend like COVID is anywhere. You could catch it almost anywhere, and you have to be North Dakota smart everywhere around that. But we're working to make sure we're accurate about how we include out-of-state people that are living here.
Am I correct that in hearing you say that there's just a few cases that we don't know about, or is it possible that there's a lot of cases that we don't know about?
I don't think it's possible that there's a lot, because anybody who's positive gets a phone call from our contact tracers. We talk to every person, and through that conversation, ascertain what they're doing. If they're positive and they're, hey, I'm positive but I'm going back to Oklahoma or Texas, we don't count them. If they say I'm positive and I'm staying here in the Bakken area, we do count them. So we're working on that, and it'll get harder when you get a bunch of college kids coming here. But I think we've got a good handle on it, directionally correct enough for people to make decisions within those areas. Online, and then Jeremy. Hey, coming back up, Michelle Kommer.
Scott Hennon, WZFG KFYR Radio. Can you share some examples of innovative investments that businesses could use to get customers back safely and use the ERG grant? And are you encouraging expansions of outdoor seating?
Thank you, Scott. Yeah, I can share a few examples, and like Governor Burgum said, we're expecting hundreds more examples as we go through this process. Starting with the restaurant industry, we've got the expanded outdoor dining, we've got the outdoor heating. Let's expand the season during which we can eat outdoors. We've got touchless menu systems, scanners that allow you to, a customer of your restaurant, to scan a code at the table and have the menu be revealed to them. Maybe they can even order online. Instead of having a menu, having a flat screen TV over the counter with the added benefit of being able to update your menu every day. Not only is it now touchless, but you can update your menu every day. Also, if we want to move a little bit over to manufacturing companies are also eligible, even though they may not have customers directly within their marketplace. They are part of the supply chain that makes the marketplace possible. And so those companies are also eligible for the ERG. Investments like partitions where social distancing is not possible. One advantage of making the manufacturers eligible for the ERG, in addition to the obvious, which is making the supply chain uninterrupted, is that North Dakota positions itself as a place where manufacturers can count on employees showing up to work because they're safe there, because the manufacturer has invested in making that workplace safe. So that would be another example. So those are a few that come to mind. Join us on Thursday again at 11 o'clock, and we will have a few more. We're receiving questions today. We'll be receiving questions through registration that we'll be working to answer at that time, and those questions will also inform FAQs. So we'll have a lot of those more specific questions answered. I would also offer to businesses that are thinking about what types of investments are appropriate for their business to consult the CDC. They have a lot of specific fact sheets relating to specific industries. You can also do a Google search. McKinsey has done some tremendous work on writing about these types of innovative infection control solutions. I could go on, and I am. HVAC systems, air cleaning systems, air filtration systems are other examples.
I know that you've done some outreach to some businesses in western North Dakota, even calling them directly. Why did you do that, and what did you learn from them?
Well, Tom, thanks for the question. We do that kind of outreach every day at the Department of Commerce. I always say we try to design solutions based on what we know, not what we think we know. And in fact, based on feedback from a lot of you here today, we've received information about companies that are struggling, companies that are looking for answers, companies that have trouble with the process through the federal government. And so I reached out, and I do this very often, to a couple of businesses in Williston, and just simply to ask how you're doing. Have you heard about the ERG grant? If you did hear about it, where did you hear about it? What are some of your concerns? That's one of the advantages, I think, of living and working in North Dakota, is our hyper-connectedness and our ability to make those phone calls. And I think that's a really important part. So we're listening and we're learning from our businesses. In fact, it is feedback from our businesses in North Dakota that helped us design the ERG grant in the first place.
Jeremy?
If you go back a few months ago, there were quite a few billboards and online ads put out by the state to promote the Care19 app. I'm wondering if there's a similar campaign in the work to promote mask wearing and hand washing.
There's been some discussion about that. I don't have anything to report on it right now, but I know that there'll be one of the things even here in Burleigh-Morton that's being discussed, which is, how do you find the right spokespeople or the right people to reach an audience that we're not maybe reaching with the messaging today. So that'll be discussed, and in the eligibility for the public health dollars from the coronavirus relief funds, communication plans and public outreach are part of that. I mean, public health, whether it's the dangers of smoking or avoiding, drugs. I mean, those things. I mean, their campaigns have been a part of public health forever, and they in other states have put a lot of dollars into that. In North Dakota, we have not yet, but it's certainly something that it would be under consideration. Okay, I think we're at the end today, but thank you all for being here. Again, thanks for everybody that tuned in. Thanks for the online press that attends every day. Thanks for the people that attend in person. Good to see all of you again. Stay healthy, and we'll see you next Tuesday at 3:30. And again, thank you, Lindsay.